Hey everybody. Sorry I haven't been on for a while and this is not my normal content. Let me show you my Bijan, Misha. If you know, I lost my other one, I don't know, maybe 2 years ago. And now I have this little guy and he's 2 years old. But let me put him down. Today I wanted to talk about something totally unrelated to dog health. It's about my health. And the only reason I'm sharing this is if you've known me from 2016, I share so that we all can learn. We're one big community. I want you to share and I share. It's just so important because there's so much out there that we don't know about. So today I want to talk about a disease that I was diagnosed with. It's called parathyroid disease. Yeah, there he is. And I'm so happy he's sitting on me. He doesn't normally like to sit on me. And I don't know where to begin, but if you or anybody you know are suffering from kidney stones that, keep on coming, or have knee pain, joint pain, please share this video. I'm not a doctor. I'm just sharing my experience. Yes, Aaron and I. So where do I begin? Let's go back a couple of months, and my journey, this is going to be part one. It is now mid-December. A couple of months ago in October, I had been suffering so much with knee pain to the point that I had to go down. I could show you my stairs are right here. See, can you see my stairs? Every morning, I had to go down one stair at a time. And my long driveway was just very difficult. So I went to physical therapy and did it for 8 weeks, and I didn't get much result. And I was very frustrated because I used to walk all around my neighborhood, enjoyed walking with my dog, and I couldn't do it anymore. So I made an appointment with an orthopedic surgeon. They did an x-ray, and they said that I had only 20% cartilage left. And more interesting to me, he said I had bone spurs and a really big one behind my knee. Now, keep that in mind. All right, so moving forward now, probably like November 18th or so, my lower left back was hurting and it continued to hurt really bad. And I thought it was a kidney stone. I've never had a kidney stone, but that's, I Googled it and that's what it said it was. So I went to a doctor and she did a urine test and said, there's no blood in my urine. She sent it off. She said, I do not have a UTI. Maybe I have a kidney stone. So I started to drink 3 liters of water a day. I'm still doing it. It's a job drinking water, but hey, it's like a hobby for me now, drinking a lot of water. And I was feeling good, and now I feel like my back is hurting again. Where am I going with this? Okay, my disease is called parathyroid disease. And I was just diagnosed with it. I'm getting surgery in February, though I hope to get it pushed up a little more. Let's talk about it. Because you haven't heard about it, have you? I've never heard about this. So you have your thyroid, which, by the way, I need to get removed also, but the surgeon said it has nothing to do with my parathyroid. I think it does, but she knows better than I do. So on the back of your thyroid, there are 4 teeny tiny glands that are the size of a grain of rice. And the job of these glands is to regulate the parathyroid hormone in your body. And it gets these signals to send out calcium in your blood, okay? And it appears, and I'll talk about the blood levels, that one or more of these glands is not working right. It has a tumor on it. It's more than likely it's benign. It's very seldom is it malignant on the parathyroid gland. And so how do you know about this? How did I find out about this? Well, to add to the story, make a very long story short, my daughter noticed that I had a lump on my in my neck. I don't know if you can see that. You see that? And I had gone to a doctor about this a while ago. I mean, just like a year ago, and they said it was probably had a virus. It was like a lymph node. And but she said she's actually saw it with her eyes. So I went to the doctor the next day, who did blood work and ordered an ultrasound. So they did an ultrasound, and my thyroid has a huge nodule in here, and I think it's full of calcium. We'll get into that. Again, I'm talking about knee pain and kidney stones. Just bear with me. And the blood work came back that my calcium in my blood was high. Keep that in mind, okay? And you get that in your regular CBC. So she sent me, I thought I was going to go to an endocrinologist, but they sent me straight to a surgeon and the surgeon did some more tests, which is separate from the CBC, to check my vitamin D and my PTH, parathyroid level. And it came back that my parathyroid level was twice the amount of the highest amount that it should be. It was 150. And my vitamin D was 52. So this is science. If your calcium level is high and your PTH is high, it's a no-brainer. You have parathyroid disease. And what it is doing is something's not right. There's a tumor on one or more of these little rice grains, and it's sending too much calcium in my bloodstream. It's pulling the calcium out of my bones, and it's going to my organs, okay? So they need to fix that. So where am I going with this? I'm 64 years old, and I wake up in the morning, and sometimes it's excruciating pain for me to, one, get out of bed, and two, go walk to the bathroom. Just so painful. I'm only 64. This should not be happening. And when I went to the orthopedic and he said that I had these bone spurs, what is a bone spur? It's a calcium deposit. Of course, he said I was a perfect candidate for a knee replacement. And I said, no, thank you. But think about it. It's a calcium deposit. What is a kidney stone? It's a calcium deposit. And I'm thinking, my God, all these people out there that have kidney stones, I'm even thinking this could be the problem with dogs. Dogs have thyroid issues. Dogs have the parathyroid glands as well. Anyway, all these people out there that have problems with reoccurring kidney stones and knee issues and joint issues. My hips sometimes hurt, and they're thinking it's osteoarthritis, which the oral surgeon said he didn't do any tests. He just said I did because of my only 20% cartilage. And I'll be damned, it could truly be coming from my body not regulating the amount of calcium that is putting into my bloodstream. And why do I say this? Is because I'm on a Facebook group. It's a hypothyroid Facebook group. And all these women are saying that they had all these issues beforehand. You could have anxiety. You could have, and I have, well, I guess I do have anxiety. You could have hair loss. My daughter thinks I do. I don't think I do. I have dry skin. I have itchy skin. Then a joint pain. There could be stomach issues, which I had to get my gallbladder out 10 years ago. And I've been doing some research, and there's also a correlation between thyroid function and getting gallstones. So look into that. So the only reason of this video, please follow my journey. Please send this to people that have knee issues or have kidney stones. And I'm I don't know where I'm going with this, but I wanted to share it with you. Okay, that's it.